Carl Jung, noted psychiatrist, said, "Where you stumble and fall, there you find pure gold." My fall happened with a sports injury at 21, which has continued to be a long-lasting thorn in my side. I, like many of you, have had to search for myself whether there's a gift in physical adversities, although those struggles convinced me that health psychology was the field for me. As a researcher and health psychologist at the Texas Tech University Pain Center, we found that long-lasting reductions of pain and suffering occurred when medical and behavioral health care were combined together with the patient's active involvement. Support for integrated care has continued to show positive results and now is recognized as a best practice standard of care. Some of my most satisfying work has been with medical staff and nutritionists in helping patients prepare for weight loss surgery. Here's a brief explanation of why an integrated approach is helpful and how one can participate to get the long-term weight loss they're shooting for. I was surprised to find that chronic inflammation is a commonly shared factor in obesity, chronic pain, infection, depression, anxiety, diabetes, alcohol and drug abuse, asthma, heart disease, stressors, social strain, cancer, and COPD. In fact, 60% of Americans have at least one chronic condition, and 3 of 5 worldwide will die of inflammation-related diseases. All these conditions are related to one another like a tangled ball of string with the thread of inflammation, which can't be unraveled in a one-size-fits-all way or cured with a single treatment. The good news is that combining medical care with value-driven, wholesome habits involving nutrition, mental wellness, restorative sleep, active lifestyle, and ongoing personal growth help reduce inflammation, especially when combined with an environment of support. So while your doctor has provided this program that can help decrease inflammation in general, the big takeaway is that the body, mind, environment, and our very relationships with one another are interconnected in a fascinating way that can positively affect our health, response to surgery, longevity, and a full, happy life. Having these measures of personal control in health and happiness is a source of inspiration and hope. Based on your questionnaire, Wholesome Map has developed a tailored program to identify barriers that might get in the way and to capitalize on your strengths and resources. Because healthy support from others is so important in deflating risk and building resilience, you may freely invite your friends and family to join you through the Wholesome Pathway app. You may be more comfortable participating independently online or having the support of a licensed counselor by telehealth. The app includes podcasts, blogs, and other online resources to help make the most of your medical care. Our approach is a compassionate one, improving habits humanely over time with a focus on how being wholesome fits into a life we really want to have now. This includes practices to relate skillfully with our thoughts and feelings, and also to live in harmony with our most cherished beliefs and values. So welcome to the journey. Let's walk this path together. There are many strings affecting health and well-being in general. The ball of strings is a term that refers to the multitude of factors that have interacted to reveal who we are today. A factor such as nutrition, for example, can be either a risk or a resource depending on its quality. The actual factors are so numerous and the interactions between them so complex that, to quote Frank Egler, nature is not only more complicated than you think, but it's more complicated than you can think. Despite this complexity, there are commonly accepted areas affecting health and wellness. Comprehensive care to address the potential risk and resources requires a team approach that includes physicians, nurses, dietitians, and psychologists. It also signals the need for a tailored treatment plan that fits each unique person. There's also a big commitment of time and energy from the patient, but folks actively involved and invested in this journey of health are more likely to be satisfied with the outcome of care by avoiding postoperative complications, by losing pounds, and by maintaining a healthy weight. Now, despite the fact that we have some personal control over health habits, it also seems that by and large, we humans struggle to set, achieve, and maintain goals. What's that about? Psychologist Kenan Sheldon found that goals not representing a person's deep interest and values are unlikely to elicit sustained energy to complete them, and when achieved, don't provide the level of satisfaction that they had expected. In other words, when it comes to long-term weight loss, the why matters. Aristotle believed that living beings had a purpose, an unfolding set of developmental potentials that are yearning to be expressed within us. These budding possibilities are shaped by this ball of string, interacting to reveal our most authentic nature. A natural expression of this growth is to learn how to walk, speak, and form social bonds. These building blocks lead to our ultimate purpose, which is to live well, to have a deep sense of inner well-being, and grow to have the best kind of life we can aspire to. Much the way an acorn grows to be an oak, it's our nature to be consistent with what we sense deeply in our bones and to be in harmony with our most cherished beliefs and values. This good, indwelling spirit, called eudaimonia, is nurtured in two broad ways. First, the development of character strengths, also called virtues, which represent human excellence. Examples include gratefulness, charity, compassion, a sense of awe with the mystery of things, and forgiveness, all which have research supporting their value to health and well-being. The best life possible is also cultivating through practical reason, sometimes called grandma's wisdom. We know it's good to pay attention, to care about, and improve the parts of our life we can control. We know it's good to correct old mistakes, discover new possibilities for moving forward. We know it's good to be in touch with the fullness of life, to be deeply present and attentive. We know it's good to live peacefully among our neighbors, to be decent, civil, and kind, finding similarities across our divisions and setting limits when necessary. We know it's good not to think too highly of ourselves, to be aware of both our strengths and frailties and our vulnerabilities to circumstances. Based on his belief of our fundamental interconnections with each other, Aristotle believed that to be at war with our neighbor was in essence to be at odds with ourselves. Thus, service to the community was the ultimate expression of a life well lived. Richard Rohr, a current day theologian, described this unfolding of human potential as uncovering the inner blueprint and returning it humbly to our world. So let's address the elephant in the room. Is health important in and of itself, or is its value measured by the freedom it gives us to live a life that really matters? Patients often tell me that they'd like to lose weight, to have more energy, to spend time with their kids, be around for their grandkids' graduation, do more with friends, or be better at work or hobbies. For many, good health may be less important as how life has been lived, the connections with others, how one has grown, and the joy created in life. The question is, how does losing weight and being healthy help us live the life worth living? How is healthiness an extension of a life well lived? Because once we've honed in on what's at the bottom of that well, then values will serve as a compass to walk on a path of wholesomeness, to keep us pointed in the right direction, and give us the oomph to pull ourselves out of the ditch when we land there. Staniszewska investigated how people lived well despite having epilepsy. He found that well-being and acceptance of illness was related to people's abilities to alter their viewpoints of life, reconsider their values and priorities, give meaning to their health condition, and have a sense of continuous growth and development as a person. I've seen many patients over the years with all kinds of ongoing pain that from the whole ball of strings have woven a beautiful tapestry of their lives, have lived well with a reasonable level of peace. The inspiration of their lives has helped my own healing too. Winston Churchill said, "Courage is the greatest virtue because it makes all other virtues possible." Maybe the courage I see in these people is in saying yes to life with all its changing weather, despite those parts that are completely unbearable. Perhaps most often, we don't pay attention to that deep invitation to act in harmony with our inner blueprint until we've had some kind of loss or injury, fall, or failure. That dis-ease may connect us with a deep intuition that we are already participating in something very good, which is given and very close at hand. From observation, it seems that those who've grown to bear pain with an open heart participate in the good life authentically, thoroughly, and more at ease. To quote Carl Jung, once again, the greatest and most important problems of life are fundamentally unsolvable. They can never be solved, but only outgrown.